Greetings, I am Reverend Dr. Shakira Sanchez Collins, and I am a primary care physician at Northwestern Medicine and also the Associate Pastor of St. James AME Church in the city of Chicago. We are currently in the midst of perilous times where Black Americans are 3 times more likely to contract the COVID-19 virus and also die from a COVID-19 infection. And although vaccine distribution has commenced throughout our nation and our world, unfortunately, Black Americans are receiving the vaccine at disproportionately low rates due to access issues and mistrust. So in this discussion, we will have our own Bishop John Franklin White, the presiding bishop of the 4th Episcopal District of the AME Church, and he will talk with Dr. LaTanya Logan, an infectious disease expert and epidemiologist, about the COVID-19 vaccine. In this discussion, we will talk about the safety and common side effects of the vaccine. We will also address myths and misconceptions. And then we will also provide information about vaccine distribution. And now we will hear from Bishop John Franklin White.
Thank you, Dr. Collins, and to all of you who gathered on behalf of the 4th Episcopal District of the African Methodist Episcopal Church. It is our joy and pleasure to be a part of this marvelous moment as we help prepare our parishioners to address some of the difficult challenges that's before them in these challenging times. Can you give us some, Dr. Logan, thank you. Can you give us some facts about the vaccine?
Okay, so let's start by talking about what's going on in our situation with COVID-19 in our communities and in the world. So this is something that you all can look at anytime you'd like. It's at the New York Times. And this starts out by showing us what was going on worldwide, because it's very important for us to understand our situation at current to understand what we need to do. So if you look at these colors, what this tells you is the darker colors means where things are worse with the COVID-19 pandemic. And if it's lighter color, it means it's better. And you can see that the COVID pandemic is now centered primarily in the United States and in Europe. Let's break it down further. Let's look at the United States. And we're all in different places. And you can see even within our different states, there are hotspots for COVID still. So there's still a lot of COVID within the United States. And currently here we have 27 million cases and almost 465,000 deaths from COVID to date. So this is an important thing that Dr. Collins was mentioning earlier. Who are the people who get hospitalized and die from COVID? We need to understand that to understand why we're all at risk. This is from the CDC, and it shows us by race and ethnicity who is most likely to be hospitalized and die from COVID. And if you look here, you can see that if you look at hospitalizations, when you're comparing to a person who is a non-Hispanic white, a Black person and a brown person, so a Black person and a Latinx person are 3 to 4 times more likely to be hospitalized from COVID, and they are 3 times more likely to die from COVID. So this is impacting our communities, and this is why we're here talking about this today. So let's break it down further. Who are the people who also get hospitalized from COVID? What are the conditions? We know it takes medical conditions where people have chronic medical conditions, and that makes them more at risk for COVID infection and having severe COVID. So who are the people? And when we look at these conditions that I have here, what you see is that if it's not you who has one of these conditions, you likely have a family member or we have friends who have these conditions because they're very common in the United States and in our communities. High blood pressure, diabetes, obesity, kidney disease, asthma, it affects all of us. And these are the people who are going to be most likely to be in the hospital from COVID. This is why we're talking about this today. So let's talk about the COVID vaccine, because that's really what everybody wants to know about. And just to show that I practice what I preach, that's me in the bottom left corner getting my COVID vaccine. And the rest of these pictures are the first healthcare workers from Chicago getting the vaccine. So I just wanted to start out by just talking really about vaccines in general. we've been getting vaccines since we were kids, and really since we were very little firstborn infants. And we know that they protect us against a whole host of infectious diseases: chickenpox, measles, pneumonia, meningitis, even the flu. But what we know about the COVID vaccine is that it isn't coming in the middle of not just a pandemic of COVID, but it's coming in the middle of a highly politicized time period. And there's a high period of mistrust, and there's also a social justice movement that is currently going on. So this is an overarching mistrust that is occurring in general in our society, and we're releasing a vaccine to this during this time. And we know that this is adding to the problem of why people are hesitant to get this vaccine. And who I want to show you here is Dr. Kizzy Corbett. She's 34. She's born and raised in North Carolina. And she's one of the lead scientists who created the Moderna vaccine. And what I want to do here is just read you a quote, because this quote is really telling about the way we all feel. And this overarching mistrust of the medical institution in general is something that is being highlighted now because of the dire circumstances of which we're in. But it is not news to me, because I am Black and I have a Black family, and I am well read on the history of injustice when it comes to medicine in the Black community. And so one of the things that I've had to step out of this and say that we're not going to be able to prove trustworthiness in this instance quickly, and that is okay. But what we need to do is decide that we're going to take the steps and, even beyond this pandemic, move in a direction to be more trustworthy. And this is the way that many of us feel, and why we are out here trying to get you the truth and the science and the information to make you strongly believe in the vaccine as we do. So let's just talk about the actual vaccines that are available right now. And just to make sure we're all on the same page, when you hear the words Pfizer and Moderna, what they're talking about are the companies that have made the vaccines. But what these vaccines are mRNA vaccines. And what is an mRNA vaccine? Well, an mRNA is actually just a piece of information. My husband does IT. And when you do information technology, one of the things you do is you sit and write code. And those codes that the computer programmers write and the IT people write are programs, things like the video games we play, or the programs we watch, or even some of the things we listen to. And that's what this is. This is actually a piece of information that is made from a code. We give you an injection, and then this mRNA, which is a code of information, goes into the body. This piece of information says this. It asks the body, hey, can you make this protein? This protein sits on the surface of a virus, and it's a harmless piece of protein. Can you make it for me? The body says, sure, of course, why not? I can make you a harmless piece of protein. So the body then does that. But then what happens is the immune system says, hey, wait a minute. What is this? This protein looks like something that's on top of a virus. Well, I'll tell you what, I'm going to make antibodies and immunity against this. So the next time we see this virus, the first time we see this virus, we're going to make sure that no one gets sick from this. We're going to get rid of this. And that's exactly how these vaccines work. It's that simple. So right now, I'd be happy to take some questions about anything that we want to discuss today.
Question, where would the vaccine be made so quickly? How was it made so quickly?
So that's a great question, Bishop. That is actually a very common question that I get. And you know, what's interesting about it is people think that it was really made fast. But the truth is, we actually, in 2009, as you might remember, we had another pandemic, H1N1 flu, right? That vaccine was made within months. So this isn't the first time this has happened. However, the other things that make this one easy is that we actually have known about the SARS coronaviruses since 2003. So 17, almost 18 years we've been working with this virus in research. Also, mRNA technology has been around for over a decade. Even Dr. Corbett, that I mentioned earlier, has been working with it over 6 years. The other helpful thing is because it's just a piece of code, a little piece of information, that once this virus came out, the Chinese, as soon as they knew that code, they sent it around the world. And then everybody dropped everything, took that code, pharmaceutical companies, governments, industries, everybody's working together. Billions of dollars go into this immediately, and we're at work the minute we get this information, even before we have treatment. And so the nice thing about this code that I'm saying, we can do this in a lab very quickly. You don't need virus, you don't need eggs, you don't need cells. It makes it really easy to do quickly.
Who were included in the vaccine trials?
That's also a great question. So a lot of people want to know, was I included in this trial? Do these people who got this vaccine represent me? They absolutely do. In both trials, about 75,000 volunteers came in these trials, okay? And who are these volunteers? They were our family members, our friends, everyone around the nation coming to get this. So because they wanted to help us get a cure quickly. So when you look at it, it's about 50-50 men and women. They had about, overall, about 20% of the Hispanic, Latinx, our Black communities, African-American communities. We had 10% in each trial. So about 4,000 in one trial, 3,000 in other, together 7,000 of our members and our relatives and family came together. And when you look at some of the other statistics, they had at least between 25 and 45% of people who are in the elderly population. And they had between 25 and 45% of people with all those high-risk conditions that we know are prominent in our community. So in my mind, they had everything we want to look at to know that we can feel comfortable.
Historically, our people have always been hesitant. And I raised the question, how well do these vaccines work?
It's a great question. You know, it's funny when we were hoping for 40 to 60% to be effective against these viruses because, you know, each year the flu vaccine is about that. But what happened was when we got the Pfizer and Moderna data, we all were just like, wow, this is unbelievable because they were 95% effective against infection. And what does that really mean? Well, what they did is they took people who got a saline injection, so just salt water, right, so nothing, and then they compared it to the people who got the vaccine. And they looked at who got sick, all the way from mild illness to severe disease. And what they found was most of the people who got sick, which is why it's 95% effective, were in the group that were just getting the saline shot. And what's great is that against severe infection, the Moderna shot was 100% protective. So nobody who got severe disease during the trial they were all in the placebo group. There was none in the vaccinated group. And there was only one overall of the people who got vaccinated in the entire trials that got severe disease. And that's what we want to prevent, right? Hospitalizations and death.
There's so many different understanding about the virus in our communities, and our people are very hesitant. What are some of the side effects of the vaccine?
Yes, you know, and it's a great question to ask because, you know, we look at the news and we know we see certain things in the news, but we don't know really what is it that I need to expect when I show up and get this vaccine, right? So I can tell you that I had the most common side effect, which is a sore arm. And the first shot I got, it was just a little sore. The second shot I got, it was a little more sore. It only lasts between 1 and 3 days. For me, it was a day, it was gone. There are some less common side effects. There are less than 10% of people who might feel fatigued or have some muscle pain. And then the rest are less common. So the next set, about 5% or less, will complain of some joint pains and headaches. Again, this is 1 to 3 days. And this high fevers are really uncommon. And as I experienced, you are more common to get the side effect with the second dose. Your arm might be a little sore like I did. Allergic reactions we should probably talk about because it's all in the news. They're super uncommon. Actually, despite what you read, there's like 2 to 5 in per 10 million people. And, you know, if you are worried, what I would say is, especially if you carry an EpiPen or something like that, you really should talk to your doctor before you go get the vaccine, just to make sure that they know what your allergy is, because we don't necessarily know and the vaccinators don't necessarily know, so that they know that you're safe to get the vaccine. But know that all the normal allergies, those people are usually very safe and the vaccine works well and doesn't cause them any problems.
My grandson, who lives in Texas, had the virus, and I want to raise a question. Do he still needs to get vaccinated because he's already had the virus?
Yes, you're hitting it right on. That's like how many of us, it's all in our communities. This is very common. Many people have been having COVID. We already just talked about how many people in the United States and worldwide had COVID. So it's a great question to ask. The answer is yes, actually, you do need to get the vaccine. And the reason is because we know that, we know that you got sick from COVID and that you have some brief amounts of protection from COVID. But what we don't know is how long that protection that you had from having the infection with COVID will last. And we also know that these are several new strains that you've heard about in the news that are circulating worldwide, including here in the U.S. And these new strains of the virus are much more contagious. And we know, and the reason they actually learned about some of these is because people were getting infected who already had infections from COVID-19 before. We do know that the vaccines will help protect us against these strains, which makes it very helpful for us all to get that to protect us from getting it again and from our families of ever getting it or getting it again.
Given all of that, will it be effective that would protect us after we've getting the vaccine?
Yeah, so, the thing about the vaccine is it does, like many vaccines, we do have to get all of the vaccine, and then we have to wait a little bit before we're going to get fully protected from the vaccine. So each of these two vaccines we just talked about are 2 doses. So the first dose is given, and then for Pfizer, you get a dose 21 days later. And then for Moderna, you're going to get your second dose 28 days later. And what happens is you're not going to be fully protected until 1 to 2 weeks after that second dose. So really, the whole process is going to take you about 5 to 6 weeks, for you to get the full protection of the vaccine.
There are many myths in our communities. Will the vaccine protect us from life? Would it be a continuous process that we have to go back and take another shot?
I know. I don't want to have to do it again either. But, the thing is that we don't know. I feel like, it's not the end of the world if it's like the flu shot, right? Where we have to go back each year and we get a flu shot. But we do know there are some vaccines that protect us for life. Truthfully, these vaccine participants, they're going to be in the trial for 2 years, and we'll know. And we already know for at least 8 months, many of them have been protected, but we have to wait the full time to see if they're going to be protected even longer. I'd like to know that too.
Thanks. This issue of social distancing and the vaccine and the wearing of masks has been a very challenging for many of our people. Can we stop wearing masks and social distancing after we get the vaccine?
Unfortunately, no. And I did watch the Super Bowl, and I was horrified as I watched, in Tampa, and everybody was in the streets, and I was like, no, but the truth is no vaccine is 100% effective, right? And, right now, what we really need is to continue to follow the guidance while we're waiting for vaccine distribution. And, we need to mask wear, we need to social distance, and we're going to have to keep washing our hands. That's just going to be part of our life for a while. But what our goal really should be is we're really trying to get about 70 to 80% of our whole population vaccinated or immune against COVID. Once we get there, then the spread of the disease, that transmission is unlikely. And then at that point, we can start getting back to life where, we can do this in person next time.
What are some of the common myths about the vaccine that's in our community? And, our community takes on all the negative stuff rather than the positive. Can you help us to address some of the myth that goes along with the vaccine?
Absolutely. And, this is so important. I'm so glad you asked because, unfortunately, some of these myths are brought about by people who are trying to prevent people in our communities and other communities from getting the vaccine. As you know, we really want our people to get in there, and there's been obviously a large push for us to try to get everybody this information. So this is a really great time to talk about some of these. So I'll talk about some of the really common ones I get. So the first one I get the question about is, will the COVID-19 vaccine will give me COVID-19 infection, right? That's a very common one. But as we talked about earlier, it's just not true. That is not true. There's no live virus. There's no killed virus. There's no human tissue, animal tissue cells, nothing of any sort of that type in the vaccine. It's really just that piece of information. It's in a little coating of fat because it needs to get where it's got to go. And then it has a few other things in there like salt, potassium, and sugar. But that's all that's in the vaccine. There's no preservatives, nothing in there. And so that's why they can use every drop in the vial. Another one we talk about all the time is, people worry, does this COVID vaccine, is it going to alter my DNA? Well, that's absolutely also not true. And, the mRNA that we talked about, it doesn't actually go inside the cells where the DNA is located. So, the body is going to get rid of that mRNA at the minute it actually gives the information and it starts to make that protein. That mRNA is out of there. So there's no way for it to alter DNA. It's not even near it. The other question I get actually, and I do pediatrics and I do women's health as well, is can this vaccine cause infertility or miscarriage? And that is actually simply not true as well. This is an unfortunate one that I believe came from anti-vaccine sites to try to prohibit people, again, from getting it. And they've actually done studies in animals. We have several women who are being followed within the trials, and none of this has been linked. Neither of them have been linked to infertility or miscarriage. There's a couple other ones that I probably really should talk about with you, which is, one of the ones is that there's a myth that there's a focus on vaccinating specific communities in order to test the vaccine. And, this is unfortunate because it's absolutely not true. You and I are talking because I want you to know the truth and the science behind the vaccines. And that's what you're getting that's happening. We are all coming out here because we want to get you the information because we are the communities that have been hit hardest by the pandemic. So that's the focus. That's the only focus, is to get everybody vaccinated so they're not dying and being hospitalized anymore from COVID. But the final one I find most interesting, which is this question about the COVID-19 vaccine having a microchip to control the population and deport people and all kind of crazy stuff that I was like, where did this even come from? I don't understand. So, this is absolutely not true. But what I can tell you what's funny about this is, I thought about this and I was like, okay, well, when this vaccine first came out, one of the issues was, they had to track it very closely, right? The boxes that the vaccine was in, because there was National Guard transporting it everywhere. People were trying to make sure no one was taking it because everybody's trying to find it, wanted it showing up places. And so the boxes were tracked, but they're tracked just the same as our Amazon box that I get every day in my house. I'm sure Amazon actually has more on it than this one. So there's no microchip in that. And when you open the box, there's these little vials. There's no microchips in the vials, on the vials, none of that. They don't do any personal gathering information. And what I tell all my people who ask me this, I said, hey, you know what? If you don't want to be tracked or have your information gathered, get rid of your smartphone, because that is doing that like every day, all of the time. So I wanted to make sure I put that to rest.
Are there some other thoughts that you want to share with us that comes to your brilliant mind at this moment, so that we can be better prepared to address some of the issues that's coming before us in our congregations and around our communities?
That's such an important question. I think what the big thing that I would say to people is, I hope that I've been able to convince you to get the vaccine. But what I also want to talk to you about that is important for you to wait your turn, right? My mother and father, right? I was just like everyone else, racing around trying to figure out, they're over 65, they're eligible here in Illinois. And in some places that's 75. But I'm racing around just like everyone else, Walgreens, trying to find a vaccine for my mom and dad, right? And I lucked out after many, many hours of finding it. And I tell people, I know many of us want it. Some of us, like my husband, are not eligible yet. But you know what? It's important for us to wait our turn, because we need to get our elderly vaccinated. We need to get all these people who are in these high-risk groups vaccinated. Many of our people are essential workers. They're working at the grocery stores. They're the ones in the factories. They're the ones bringing us those Amazon boxes with the tracking. They're the ones who are out there every day and have been out there every day during the middle of this pandemic. They never went home, never. And we need to get them the vaccine. And so I tell people, let's really push our people who we know are the ones who are going to be high risk for dying and hospitalization, and get them the vaccine and encourage our family to get out there and get safe.
Greetings. I'm Reverend Dr. Talia Phillips, who is honored to serve as a family practice physician at Oakland Medical Group in Albion, Michigan. I'm honored also to serve as assistant pastor to the amazing Brown Chapel African Methodist Episcopal Church in Ypsilanti, Michigan. We have been richly blessed with a host of wealth of knowledge from this amazing experience today. I am, as a family practice physician, as a Black family practice physician, have been inspired today by the conversation that has taken place between our bishop and Dr. Logan, and I know you have been. I just want to remind us of what we've heard today. Today we've been reminded that yes, we are in the face of a global pandemic, but it really has some very local impact here in the United States, and that impact is even more pressing in the Black and Brown communities. We've heard today that African Americans are more likely, 3 to 4 times more likely to contract COVID disease, and 3 times more likely to die. That's a wake-up call to our community. And today we've decided to present information that is intended to equip and empower God's people to make decisions that can be the difference between life and death. Today, we've been reminded to use medicine and science and facts to make decisions about what is best for our lives and not myths. Today, we've been reminded that it is important to take history into perspective, but recognize that it is brown African American people who have helped create this vaccine. It is African American people who have been a part of the scientific studies to assess the effectiveness of this vaccine. And it is African American and brown physicians and healthcare workers who are being a part of the conversation to help get the information out and help create access so that our people are not disproportionately impacted by this terrible disease. So we encourage you today to make a decision to share this information with those that you know, to share this information with those that you love, so that we can move through this together better. We also want to collectively encourage everyone to be vaccinated. When your turn and opportunity comes, we strongly encourage you to take it. We strongly encourage you to take full advantage of every opportunity that we're given for life and life more abundantly. We also want to remind you that while you're waiting your turn, to practice social distancing. While you're waiting your turn, mask up. While you're waiting your turn, practice hand hygiene. We also want to remind you that you have access to this kind of information and so much more. Talk to your family physicians, and if you don't have one, get one. And if you don't have one yet and you're working through that process, make contact with your local health department, because they can give you the most important and relevant information to what's happening in your local areas. We hope that this information has inspired and encouraged you, and believe in faith that God will help us do the rest.
All right, gracious God, I just want to thank you for bringing us together in this cyberspace to do your work, to care for Black lives. We just thank you for all that has transpired on this. And we pray for all those who are here and their families. And we just ask that you will anoint this, that you will empower this video to reach the people that need to be reached. This we pray in Jesus' name, amen.
Let me take this moment to express my thanks to you, but I also want to share that we need to do all that we can to encourage our parishioners, members of our congregation, the importance of this vaccine, and to make sure they take advantage of these opportunities. Thank you so much for your wisdom. Thank the committee for your insight. I want to thank the pastor. It's a marvelous moment that the church is on the cutting edge. The trying to help our people to be safe and to live longer. God bless and thank you.